Alright guys, and welcome back. Today we're going to be talking about cavities. Now, this PowerPoint, this lecture is going to be kind of a demonstration as to what I want your end of the term projects to look like if you have me in Anatomy and Physiology 1 and 2. So with cavities, early stages, there are no symptoms. Remember, symptoms is kind of what you feel, right? I can't tell if you're in pain or whatever, right? I just have to go by what you're saying. Anyways, early on, cavities don't have any symptoms, but they do have signs. So if I look at your teeth, I can see white spots, brown spots, black spots on the surface of the tooth. There could be some whiteness there or kind of chalky areas on the tooth enamel. And as this disease progresses, what's going to happen is you're going to start feeling things, right? So you eat something that's hot, that doesn't feel too cold, good. Or cold, same idea there, but the most telling is going to be sweet, right? So if you eat something sweet, no, that kind of hurts my tooth, that's very concerning, all right? You can have a mild toothache, some days your tooth bothers you, some days your tooth's totally fine. And then, a lot of times what will happen is it'll hurt when you bite into things. You can look at the tooth and you can see kind of pits in there. Now, as it advances, it gets worse and worse and worse, right? The pain doesn't come and go anymore. It stays, right? It ain't going away. And you're going to get more and more sensitive to hot, cold, and sweet. If you look at this poor man's gums over here, they're a little swollen. Why? Because your tooth decay is getting worse. All right, your breath can have an odor to it, and your teeth, your mouth doesn't taste good. Just like, there's always kind of like a sour taste or a foul taste in my mouth. All right, now risk factors for tooth decay: snacking. The more often you do it, the worse it's going to be. Sweet foods, acidic foods, not brushing, flossing, or using fluoride. If you have dry mouth, some people, their spit's more acidic than others. If you have pits in your teeth, right? So pitting, it can be a cause by tooth decay, but some people, they don't have any tooth decay, but they already have pits in their teeth, and so that's going to set them up there. All right, crowded teeth, right? So crowded teeth, it's harder to get in there with the floss, the toothbrush, and get all that plaque off right there. If you smoke or chew, you're more likely to get it. If you have diabetes, you have reflux. Children are at increased risk for getting tooth decay. Why? Because their teeth are thinner. Their enamel is not as thick as it is in an adult, and the enamel is not as acid resistant. And then in the elderly, a lot of them will have diabetes, and they'll also put them at an increased risk for tooth decay. Now, there's something called disproportionate comorbidities, right? So a comorbidity is another disease that you can have, or illness. Well, sometimes when you have something wrong with you, you're more likely to have other things wrong with you than what you'd expect based off of random chance. So for example, you're more likely to have diabetes if you have tooth decay than if you don't have tooth decay. You're more likely to be obese, have sinus infections, ear infections. Oddly enough, iron deficiency anemia. I was kind of surprised by that one. Speech issues, pneumonia. That makes a lot of sense because the bacteria in your mouth, when you inhale it a little bit, when you're sleeping, if it has a lot more bacteria in that mouth, it's a lot more likely to cause pneumonia than if it just has a few bacteria in there. Heart attack and stroke. All are more likely to occur if you have tooth decay than if you don't. How are cavities diagnosed? So what happens is the dentist, they're going to look for those white chalky spots or brown or black discoloration of the teeth. They're going to look for pits in the enamel. They're going to look for plaques build up around those areas. They're going to probe the test with kind of that probe and see if it catches. They're going to look at x-rays. So the x-rays, one of the things they can do is they can see how deep the tooth is decayed. So is it going to see kind of more of a black spot? A spot of demineralization of the tooth, and so they can look at that pattern and see, yeah, this is definitely tooth decay. And so that's what they're looking at to really figure out whether or not you have tooth decay or not. So shifts in the diagnosis of tooth decay. So pretty much, before the 1960s, what they did is they only looked for holes or soft spots. And they said, you know what? That's a cavity. We need to drill and fill. And that's pretty much throughout history how tooth decay was managed. All right, and diagnosed. So, and prior to that, if you go further on back, they just pull out the tooth that hurt. Hopefully they got it. All right, so one of the things is 1970s to 80s, they had the bite wing x-ray. And so they would actually, that thing you bite on when you go to the dentist, and they are, right? That's what they're talking about. And so they could see the decay in the tooth before you actually started getting holes in there. All right, the 1990s to 2000s, what they started doing was they noticed that the white spots, they said, hey, look, we got some demineralization here, right? Your teeth don't have as many minerals as they should, but you don't have holes in the teeth yet. You're definitely headed down the tooth decay route. Let's try to reverse this. And so 2010 to present, digital imaging, even infrared, all of this is working for subclinical detection, right? So we're picking up your tooth decay before you even realize you have cavities, right? Your tooth doesn't bother you, no problem whatsoever. You don't even have holes in the tooth yet. And so the idea is we're going to prevent it from progressing to the point where it has holes. So we're trying to get away from that filling and drilling. All right. So the old treatment, as I said, mainly filling and drilling. With this advanced technology, one of the things we're looking at doing currently is more of treatment based off of risk level, right? So if you have few risk factors, no current decay, right, we're just going to use routine cleanings, fluoride toothpaste, right? And so we're going to keep the status quo. If it's moderate risk, so you have some risk factors, but you know what, we don't see any sort of active decay. All right, we're going to use a fluoride mouth rinse and maybe start changing your diet. Tell you, hey, stop eating so many candy bars, that sort of thing. Okay, high risk. You have multiple risk factors or recent activity, right? You had a cavity within the last 3 years. What we're going to do is we're going to give you prescription strength fluoride, xylitol gum, chlorhexidine mouth rinse. We're going to do more frequent checkups. Usually we recommend a checkup every 6 to 12 months, so more frequent than that. If you're at extreme risk, right, what we're going to do is you're high risk and you're not making as much spit, right? It can be because you have Sjogren's disease, that's a medical condition. It could be because you're on medication that does it. And so we're going to go everything we mentioned above, right? The prescription strength fluoride, the xylitol gum, the chlorhexidine, the more frequent checkups, the saliva substitute, and intensive remineralization therapy, right? We're going to try all of that stuff, right? And then if that fails, obviously we got the filling and drilling. But you can see the current treatment paradigm, we've shifted way away from just filling and drilling, right? We're way less likely to pull a tooth than what we did before, right? Now we're going to try to cap it, we're going to do root canals, and if all else fails, yes, we will remove teeth, but that's kind of like the end of the road. That's not, hey, this is stop number one. So one of the things that's really changed from previous years and stuff like that is how much treatment we have for tooth disease. Early stage decay, right? That white spots, they did absolutely nothing, right? Moderate, you could have had it filled, they didn't really do anything. And so most of the time, it was advanced decay. And so they just took out the tooth. We're not talking about crowns, we're not talking about fillings, we're just taking out the teeth. Was the most common way that it was handled back in the day. And so by the time we were 40 years old, half of adults had a complete set of dentures. Right? This is George Washington right here. He had dentures at age 26. a complete set of dentures at age 26. That's just crazy. Imagine 26 years old and you didn't just get your first cavity, you had your last cavity. Right? You ain't gonna get any more cavities because all your teeth are gone now. And one of the big problems they had is because of no antibiotics and everything else, the abscessed teeth could actually cause brain abscesses. It could cause Ludwig angina, where you get terrible pain under the lower jaw, stuff like that. Unfortunately, high rate of death. So major issue here. So major improvement in the prognosis, right? It went from being a fairly high chance of dying to now it's just like, oh yeah, I'm getting my teeth filled today. No big deal. And this is just showing you, once again, how much that prognosis has improved, right? A lot of times it can be reversed, right? Even with, if it's just that white spot, we can often reverse it. And a lot of times the doctor will tell you about it, whereas before you didn't even know about it. Yes, if you have a cavity, unfortunately permanent damage is done, but we can drill and fill and it'll stop any sort of progression right there. And yeah, you can have that tooth pretty much for the rest of your life. If it's gone down to the dentin, you're gonna need some Novocaine at this point in time. And so, yeah, you're going to have problems. There's a chance that you're going to need more work on that tooth later on in life. But overall, fairly good. Now, if you're having to go all the way down into that root, okay, you're doing a root canal, right? One of the big thing is if you take care of it, you might get a few decades out of it. But, there's more of a chance that this tooth is going to fall apart, but still it's not bad. Whereas if it's spread beyond the tooth, yeah, there's a real good chance we're taking the tooth out. But you know what? That's like in the worst case scenario. I mean, this thing's been neglected for very long at this point in time. This is not the typical presentation. So major improvement here. Okay, so frequency. 90% of adults have a carie in a permanent tooth, right? And so the average adult, we got about 9 to 10 teeth that are decayed, missing, or filled. So decayed, obviously you have a cavity in there. Missing, we had to pull out your teeth. Filled, right, we drilled into it, we put concrete there, fixed the problem. And so, you look at this, they're saying about 26% of adults have untreated cavities at any given point in time. And root caries affect about 50% of the elderly. So as you get older, you get more and more tooth decay, and your tooth decay tends to become more serious. So how has this frequency changed over time? Well, prehistoric times, it was very, very rare. We're talking about 5% chance of having a decayed tooth. Right? They do know that skeletons from this time, the tooth had a lot of kind of wear and tear on them, but pretty much no tooth decay. All right, and they're thinking that they ate a diet that was very high in plants and meats and very low in any sort of sugar. So the Neolithic Revolution, that's when we had farming. So we basically introduced grains and cereals and stuff like that. More of a starch-rich diet. So about 7.5% of people had tooth decay. All right. By the time that we got into the Bronze Age, we had stone grinding, and so the foods got softer, more starchy. We're starting to get honey involved, and so we're looking at more of that, about 10 to 15%, definitely closer to 15%, more above the 15% if you're an area where you have honey. Medieval ages. So it depends on how rich you are. So richer people had more access to sugar. Why? Because it's very expensive. And so they had about 15 to 20% rate of cavities, whereas the commoners is only about 10 to 15%. Why? Because they're not eating as much sugar. All right. One of the things is this same thing is still occurring by the 16 to 1700s. So wealthy, up to 40% of them had cavities. Why? Because they can afford the sugar. Yes, sugar is getting cheaper for everybody. Even poorer people are starting to be able to eat sugar. And so they got somewhere between 15 to maybe 20% cavities. Why? Because they're eating more of that coarse bread, vegetables, and meat. 1800s, 40 to 60% people having cavities. Why? Because sugar's becoming cheap for all. And so if you're living in the city, that's where you're going to see the most improvements in the standard of living. And so you're going to have the highest rate of tooth loss. 1900s, you're looking at roughly 80% of adults will have tooth decay. And why? Because sugar and flour are becoming the main foods that people eat, right? And what's really crazy is even though this tooth decay is going up, the services for tooth decay haven't risen as fast as the rate of tooth decay. So how are things changed in the USA since 1900s? And so you look at this, 1900 to 1940s, pretty much all adults had tooth decay. And by middle age, most adults had multiple teeth missing. One of the things that's crazy is you see this child over here, and they're pulling out his teeth. By 12-year-olds, most 12-year-olds had multiple cavities. And yeah, that home dentistry was not unheard of. And 65% of people had this untreated decay, and it was mainly treated by filling and pulling. And so what was causing this? The sugar in the diet, no fluoride, no sealants, no dental cares. And so, as I said, this is just mind-boggling that by the time you're 30 years old, you had a 1 in 5 chance of wearing dentures. I mean, it's just stunning. And by the time you're 50 years old, you had a 1 in 2 chance of wearing dentures. And I'm not just talking about for just a few teeth. No, I'm saying all your teeth are gone. Right? You had a complete set of dentures. Just absolutely mind-boggling. So fluoride was introduced in the 1950s. So it started in 1945 and just really became way more common by the 1970s. We put fluoride in the toothpaste. And yes, children still had tooth decay, but only about 30% of children had tooth decay in their permanent teeth, and that was on the decline. And so adults in the 1950s had about 15 out of 28 teeth decayed, missing, or filled, but by 1970 it's only 13. And so about 50% of adults, half of them, have untreated tooth decay. 1980s to 90s. So now what we're doing is we're putting sealants here. And so what we're doing is we're putting basically this concrete on top of good teeth. And so what this is doing is it's stopping the bacteria from just destroying your teeth. And so over time, yeah, the sealant will wear out, but I'd much rather wear off my sealant than wear out my tooth, right? And so it's basically stopping the bacteria from getting there, all right? And so we're doing more public health campaigns at this point in time about brushing, flossing, and not having as much sugar. The rate of tooth decay by 1990 was half of what it was in 1940. But still, 60% of children have lost one permanent tooth to basically either tooth decay, decayed, missing, or filled. And 95% of adults will have a decayed, missing, or filled tooth. But more and more teeth are being saved. So now we're only down to 12 teeth that have been decayed, missing, or filled. 2000s, 2020s. So we're kind of leveling out right here. So 60% of children, decayed, missing, or filled tooth. The average adult has a decay, missing, or failed tooth score of 12. And so that score goes up by about 1 point every 4 years. So on average, you can expect to either have the dentist tell you, hey, look, you got a tooth that's decayed here, let's fill it. Or, hey, let's pull out this tooth about every 4 years. And so, that really is kind of crazy. By the time you're 65 plus, 99% of people will have had a decayed, missing, or failed tooth. And still, we're looking at about an 18% chance of untreated root caries, which isn't great, but that's a dramatic improvement from 65% in the 1900s. And so the number of decayed, missing, and failed tooth, 18 to 19. And missing teeth make up most of the decayed, missing, or failed tooth score. So even if you just say half, that's 9 missing teeth by the time you're 65 plus. So, definitely an improvement there, but still work needs to be done. And so a big part of tooth decay is your diet, what you should and shouldn't eat. And so getting a list here of the least cariogenic foods, you want non-fermentable carbs, right? So cellulose, that's going to be your fiber. You're going to have resistant starches, so you need to be able to chew, right? You don't want a lot of free sugars. You don't want a lot of simple carbs. So sucrose, fructose, glucose, you don't want that stuff. You want low acidic fruits, bananas, melons. You want to eat them with meals. Proteins, they're non-cariogenic, right? Meats, fish, eggs, okay? Fats, non-cariogenic, all right, if they're natural. Dairy, they actually may be carioprotective, all right? So cheese, milk, yogurt, right? They're rich in calcium. That's going to help remineralize your teeth. Casein actually protects against tooth decay. For your beverages, water. Unsweetened tea, all right? Milk, right? You don't want acidic, juices. You don't want acidic, sugary drinks such as sodas and juice. Frequency of eating. You don't want to snack. And if you eat something that has sugar in it, eat it with the meal. That's going to limit the amount of tooth decay. All right. So let's break down each of these categories by what's going to be cariogenic versus non. So one of the big things you're looking at is like melons, berries, apples, pears, kiwis. I really want to eat unripe bananas. That doesn't sound too good right there. And plums. More your cariogenic fruits are going to be dried fruits. And one of the big problems with those is those are going to be sticky. Anytime you dry a fruit, you concentrate the sugars. One of the things I was surprised about right here is the bananas, because those simple sugars. Mango, often, I just love mango. It tastes wonderful, but apparently I need to make some changes if I want to keep my teeth. Pineapples, very acidic. I knew they were acidic, but I didn't realize that wasn't so good for your teeth. Grapes, citrus fruits, the acid is going to be an issue right there. Now, the fruit juices, one of the things to be aware about this is the added sugar. A lot of what you think of as fruit juice is actually juice flavored sugar water. And so that's going to be a major issue. Then on top of that, the lack of fiber, you're not having to chew it, and so it's not scrubbing your teeth, scraping off that plaque. All right, let's look at the grains. So low cariogenic grains is quinoa, millet, amaranth, steel-cut oats. Apparently that's more healthy than our rolled oats right there. And so it's not going to be that instant oats, brown rice, barley, rye, whole wheat, berries is going to be a lot better for you. Whereas the more cariogenic is going to be that white bread, crackers, Cereals, yes, definitely sugar. Cereals, tons and tons of sugar added there. Um, and so, yeah, I was really kind of surprised by the fact that crackers was bad for you, because apparently it clings to the teeth, right? So anything that's going to cling to that teeth is going to be bad for you. And then white rice is not good for you because it sticks to the teeth. So I tried to find carcinogenic nuts, and they don't exist, right? So as long as you're not coating them in chocolate or sugar or whatever, they're not carcinogenic. Obviously, you want to make sure that it's not going to stick to your teeth, and so very helpful there. So dairy, your cheeses are going to be better than your milks. The harder the cheese is going to be better. Once again, you're worried about stuff sticking to the teeth, and you're worried about any sort of sugar, right? So if they're adding sugar to this, it's not good for you, right? So sweetened milk, chocolate milk, ice cream, yogurts, right? Especially fruit on the bottom. Why? They like to add sugar there, all right? And it makes it a little bit more sticky. Milkshakes, smoothies, even if it's homemade right there, it's not as good. Why? Because you just, right? You're constantly sipping it. And each time you sip it, your mouth is going to become acidic for about 30 minutes. So drinking a glass of milk, right? You're going to glug, 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 glug. That thing's going to be gone in under a minute. But you can easily sip a milkshake for 20 minutes or so, 30 minutes. And so you're really spreading out how long your teeth are dissolving for. All right, best non-carcinogenic beverages. Once again, anything that's not sweet is going to be helpful there. If it is sweet, they're saying a xylitol sweetener can help, and so that could be a big help there. Avoid anything that's acidic. Interesting thing right here is your teas. Your black tea, green tea, even though it's on the acid side of things, a pH of 4.5 to 5.5, because it has the polyphenols, it's shutting down the bacteria that dissolve your teeth. And one of the things that also tends to be higher on is going to be fluoride. And this is important because the fluoride reduces the pH needed for your teeth to dissolve. Now, the things you want to avoid that really will destroy your teeth is sodas. Why? They're acidic, lots of sugar. All right, and then once again, people sip, 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 sip. And that's going to cover pretty much most of your juices, especially your orange and apple juice, grape juice, because of the high level of sugar and the low pH. Energy drinks, a lot of those are just sugar, right? That's not good. Tea's good, coffee's good, but the problem is they add sugar to it, right? And that's going to destroy even the iced coffee as well. So watch out for that. So watch out for anything where you're adding sugar to it. You think smoothies, even if you're not adding a lot of sugar to it, you're still adding sugar to it. And, once again, that fruit juice that you're adding is sugar, even if you grind up the fruit, because you're sip, 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 instead of drinking it, it's not good. So watch out for that. Things are different about tooth decay around the world. So one of the things is America, we actually have a lower rate of tooth decay than a lot of developed countries. So, for example, Canada, pretty much most of Europe, Australia, New Zealand, these are all developed countries, but they have way higher rates of tooth decay than America. And a lot of this has to go deal with their type of medical system. So they use socialized medicine. So in America, if your tooth's bothering you, you can get into the dentist within 24 days. Whereas in Europe, not unheard of for it to take several months for a new patient. And even with urgent patients, it's, man, this tooth's really bothering me. I gotta get in quick. Not unheard of for it to take 3 months. If you, as I said, just a routine new patient, it can take over 18 months in some cases for the socialized medicine. So that's kind of a major issue here. Now, the other thing I found pretty interesting about differences in around the world is you look up in Africa, India, China, all right, they have much lower rates of tooth decay than what we do in America. And what's crazy about some of these countries, some of these places, is people don't brush their teeth or anything like that, but yet they have way lower rates of tooth decay than what they do in America. And it goes to the fact that they have less sugar in their diet. So here's an interesting blast from the past. There was a dentist, he went around the world, his name was Western Price, and what he found is it didn't matter what country he went into, when they're eating the traditional diet, they literally look like a commercial for braces. Come to Aspen Dental, we'll give you a smile you love. I mean, just these teeth are perfectly straight. Absolutely zero sign of tooth decay. Just absolutely crazy how nice these teeth are. And then what happened? They started eating modern processed food. And the poor natives have no idea why on earth their teeth are hurting them so bad. Look, I've been eating, my dad, grandfather, nobody's had teeth problems like this. If they do, I mean, they get it when they're old and, about to die and, so on. And now we're seeing this in young people and this terrible tooth decay. And I mean, this poor man, he only has like 2 teeth left up top. And, just horrible. And so they kind of learn how to manage, with drilling and filling. But with this modern processed food, it actually produces a lot of problems with crooked teeth and, buck teeth and everything else. And, this just wasn't in Africa. He saw this same pattern repeated wherever he went. So he kind of went to Canada, saw all the Canadian Indians. He went to Great Britain. He went to Italy. He went to basically Australia. He went to the South Pacific. He pretty much went everywhere. Wherever he went, he saw the exact same trend. So it really is quite crazy the effect that your diet has on your dental health in general. So, can animals get cavities? Yeah. This was one of the things I was really surprised with how often cavities occur in animals. I thought it was pretty much just a human disease. So, fruit bats have the highest rate of cavities. And so they got about a 17% chance of getting cavities before they die. And it's because their diet is so high in fruit and in nectar, and they hang upside down for hours, and so the that food is just sitting on their teeth there. Great apes have about a 12% chance of getting tooth decay during their life. Why? Because they eat a lot of ripe fruit that gets stuck on their teeth. Bears, about a 7.5% chance of getting cavities during their lifetime, and it's because they're eating those berries, and unfortunately they'll get into human garbage and eat our food there. All right, raccoons, about a 4% chance, and so they're eating sweet corn, fruit, human garbage. All right, another thing you see is macaques have about a 3.5% chance. So tropical fruit, human foods. All right, wire rodents, fruit, seeds is going to be the big thing there. So a couple of things that's different about the management of tooth decay in animals than in people. A lot of times the animal will die before the tooth ever becomes a problem. And if the tooth becomes a problem, we just take it out. That's going to be a big thing right there. Obviously, you can't tell your dog to brush their teeth, right? So the person can do it for them. But a lot of times what will happen right there is we'll just do more diet change right there. So we look at more of a fibrous diet. has abrasive food that will kind of brush their teeth for them. Now, there are some animals that don't get cavities. So, for example, cows, sheep, goats. And the reason being is they produce a lot of spit, a lot of saliva. And so that's rinsing out the mouth. That's getting rid of the bacteria right there. Their diet really doesn't have a lot of sugar there. It's a very abrasive diet. And so, for example, the cow, sheep, and goats, they're just constantly producing new teeth in a new tooth, and they're wearing off the surface of the tooth. And so if they do get a cavity, they're just going to grind it away in a little bit anyways. All right, so carnivores. So in the wild, meat, that's what they eat. And so that doesn't cause tooth decay. And so the problems they're going to have is from breaking their teeth, all right, or wearing them down. Sharks, reptiles, right, they're just constantly making new teeth, right? Their teeth aren't in there long enough to cause a problem. One of the major reasons why people get cavities more often than animals is a couple of things. Number one, the amount of sugar that we add to our diet. Number two, the fact that we live so long, right? And our teeth stay in our mouth for so long. So you look at a sheep's not going to live so long. A cow's not going to live so long, right? We're looking at like 18 months and we're harvesting them, right? When we're 18 months old, cavities are pretty rare, right? But people, we're living to 75, 80 years of age, and so those teeth have to last a lot longer. All right, so here's something kind of interesting, controversial that I found on it was rats. They're the most commonly modeled animals for caries studies. And so what we can do is we can predictably get them to develop cavities if we put them on a high sugar, high starch diet. For mice, we can actually do genetic studies. So for example, we can mess up the way they produce enamel so they don't make enamel quite right. We can make it where they don't produce saliva. We can change the bacteria that's in their mouth to make them get cavities. Hamsters. What we do is, once again, that diet, and we also kind of look at the bacteria we want to put in there to make them more likely to get cavities. Non-human primates. So, macaques. One of the things is the way the teeth are and the what bacteria they have in the mouth is kind of more similar to people. And this has kind of fallen out of favor because of ethics and cost. And so how do we cause these cavities? Usually high sugar diet, right? We just soak the food with sugar, which is kind of what we do to ourselves, right? Everything is sugar sweetened. Streptococcus mutans is the most common bacteria that causes cavity in people. So we'll put that in their mouth right there, see if we can't cause cavities. We put conditions that really reduce any sort of fluoride they're coming in contact with. Sometimes we'll go in and cut out their salivary glands. We'll give them medicine so they don't produce saliva. All right, and so why do we do this in animals? Well, we want to understand what foods will give cavities, what foods prevent it, what bacteria, how can we change the saliva to help prevent or cause cavities. So the big thing is that prevention, right? So we try these preventative treatments such as fluoride, tooth sealants. We might replace their teeth, see how long the teeth last for. All right, and as I said, see what genes and bacteria are going to help move you towards or away from getting cavities. And so ethical controversies, considerations right here that we run into is, the animal welfare, right? Is it right to kind of hurt animals to help people, right? That's where a lot of people kind of run into that. And here's the classical ethical dilemma. Do I run over a person if I can save 2, 3, 4, 5 people right there? One of the ways we try to make this more ethical is we limit how bad we let the tooth get. Or if unfortunately we have to let it get pretty bad, they try to give pain medications. And so this is falling out of favor, and it is a lot more heavily regulated now. So another one controversy right here is filling or reversing tooth decay. So traditionally, as that fill and drill. All right, we got a problem. Let's just drill it and fill it. Now what they're trying to do is more of that reversal. Hey, look, I see a white patch right here. Let's use fluoride and sealants and so on. See if we can't fix it. Change what you're eating. And so there are critics of either approach. So the traditional critics, they say, well, look, you're filling and drilling something that we could have just treated with fluoride and maybe a sealant. And then the problem with filling is a lot of times things get worse over time. So you do a small filling, then it becomes a bigger filling, then it becomes a crown, then it becomes a root canal, then we're taking out the entire tooth, right? Whereas if you had just used the fluoride and the sealant, we wouldn't even be down that road. Whereas those that are saying, hey, the modern approach is a little crazy, yeah, that's great, we can do these things, but will our patients actually do it, right? That compliance is a big, big issue right there. And you know what, we might be playing around with this stuff, we're going to try to reverse it, and now instead of just a small filling, we got a big filling that we have to do because we didn't jump on it soon enough. So here are some things I found kind of interesting about tooth decay, is there's actually lookalikes. So for example, you can get stain on your teeth. So now the doctor thinks you have tooth decay, but you don't. And so they end up drilling a tooth that's not a problem. So one of the things to look at is the tooth hard? And that's going to be for most of these. So excess fluoride is going to do the same idea there. The cervical burnout on x-rays. So what happens is when we take an x-ray of your teeth, sometimes the teeth can cast shadows on other teeth. And so it looks like you have tooth decay there, but you actually don't. And so now the doctor is drilling and filling when you really don't have that. And so the trick with that is we want to change the angle at which we're doing the x-ray. So if we're changing the angle and your tooth decay shifts, okay, that's going to be kind of key. If your tooth decay kind of looks fuzzy, that could be a sign that, hey, that's actually tooth decay. All right. If I'm tapping that spot on the tooth and it's hard, that's kind of a sign that's also not tooth decay. And a very common one for people not going to the dentist is they breathe in, oh man, my tooth hurts right there. I must have a cavity there. All right, well, maybe you do, maybe you don't, right? But typically that's going to be a very short lasting, right? It's not going to, oh man, that hurts. 5 minutes later, it's still hurting. Okay, that's probably more like a cavity right there. Hot, cold, maybe your teeth are just sensitive. But if you're eating a candy bar and that really hurts, right? Or you're just sucking on a lifesaver and out of nowhere that one tooth hurts you, that's probably a cavity right there. All right. So I thought that was kind of interesting right here. Here's just a picture of that fluoridosis. And, you just look at it, it's like, oh my goodness, that poor boy has severe tooth decay. Nope, no tooth decay whatsoever, just too much fluoride. All right, so how does tooth decay affect the different systems of the body? So it can obviously it's going to affect the digestive system. And so what's going to happen is because you have this decayed tooth, it often hurts when you chew. So you're not going to chew as much. And so because your food isn't chewed as well, it's going to take your stomach longer to empty it. You're not going to be able to suck the nutrients as much. You're not going to produce as much saliva, so it's going to be harder for you to swallow. All right, because it hurts when you chew, you're going to pick foods that you don't have to chew as much. So you're not going to eat as much vegetables, nuts, fibers, meat, and you're going to tend more towards sugary foods right here. And so, no surprise, that's going to increase your tooth decay. You're going to have more constipation, less vitamin C, less folic acid, less calcium is going to be in your diet right here. Because your mouth is filling up with bacteria, it can actually change the microbiome in your GI system, particularly your mouth, but even your small intestine. So irritable bowel syndrome, inflammatory bowel disease, peptic ulcer disease are all going to go up right here. And it's not just the GI system that's going to be affected by tooth decay, it's your muscular system as well. So, for example, TMJ, you're going to avoid all that tooth, and so you're not going to be eating quite right, and now your jaw's hurting you. Your bones can actually dissolve a little bit in your jaw. Because you're not eating foods that's high in calcium, you're going to actually head towards osteoporosis. The bacteria in your bloodstream can actually accelerate heart disease. So your arteries in your heart are going to fill up with cholesterol faster. The bacteria in your mouth can get into your bloodstream and can get on your heart valves. And now your heart valves can get holes in them and stuff like that from all the bacteria. When we sleep, we often inhale some spit. Well, if that spit is filled with bacteria because you have bad tooth decay, you're more likely to get pneumonia than if your spit doesn't have a ton of bacteria in it because you don't have a lot of tooth decay. Your nervous system. That chronic inflammation can actually increase your rate of Alzheimer's and dementia. The severe tooth pain can cause trouble with sleeping and concentrating. With your endocrine system, the changes in your diet because of the tooth decay can actually worsen your glycemic control, so it's harder to control your blood sugar. This one was kind of surprising right here. With tooth decay, it can actually make you more likely to have a preterm birth. And so your baby is born early because you didn't brush your teeth enough or floss them enough. The urinary system, because all the bacteria is constantly getting to your system because you have this decayed tooth, it can actually cause kidney disease or worsen it. Once again, with the immune system, because all that bacteria is entering the bloodstream, we're kind of worsen that inflammation, which can actually trigger or worsen autoimmune diseases. And the integumentary system can even be affected by tooth decay as well, because the infection can spread to the face. You can get cellulitis, and it can also cause acne, particularly the lower jaw and around the face. Alright guys, so this is my reference page. Ideally, you want to have about 3 to 5 references. I just did one for the sake of simplicity to really kind of give you an idea of what's going on here. Now, why am I having you do this project to begin with? So the reason why is obviously I want you to learn about the disease in question, right? You guys are going to have something other than tooth decay to do your project on, but the reason why I'm having you talk about animals, how this is different in the USA versus other countries, is to really kind of give you a deeper appreciation of the topic, right? If I just had you do USA medicine, you would get the textbook answer on things, but the textbook answer isn't always best. So, for example, things that I learned as Dr. Perkins, right? And to just give you a quick thumbnail of who I am, right? I'm a medical doctor in the United States. I got trained in medical school. I've done extensive reading outside of medical school. I've read several textbooks. I teach at a local university. And so also in terms of tooth health, you know what? I've never had a cavity. So you think this is something that I'd have in the bag. But personally, me as Dr. Perkins, I've learned a lot of things while doing this presentation here. And so one of the things I've learned while doing this presentation is the importance of avoiding tropical fruit. You would think fruit's healthy for you, but no, a lot of the animals that were getting cavities had tropical fruit. Was one of the big things they had, was eating that fruit. And so learning that if you eat fruit, eat that at the beginning of your meal, and then eat something like meat or something that's really kind of chewy, like a vegetable like celery or whatever, to kind of help clean your teeth out. So I thought that was really kind of crazy and interesting right there. And the other thing that really was kind of eye-opening was just how aggressive you need to be if you want to keep your teeth. They were saying that in the 1900s, the chance of having a full set of dentures by the time you're 30, 30 was about 1 in 5. and the chance of having a complete set of dentures by the time you're 50 was 1 out of 2. So it really is just absolutely mind-boggling just how aggressive you have to be about managing those teeth. And the other thing was, as important as brushing your teeth is, reducing the amount of sugar in your diet is even more important. You look at places in Africa where a lot of people don't even brush their teeth, or India, their rate of tooth decay is a lot lower than what it is in America. Now, when they get it, it tends to be a lot more severe because there's no real treatment or medical management. But still, I just thought that was really kind of wild and crazy. Just really how serious those things are. And then if you do brush your teeth, if you only had to brush your teeth once a day, the most important time to brush your teeth is at night. I also thought that was kind of neat and kind of, helpful to be aware of that. All right, guys. Well, I hope all this helps, and good luck on your projects.